Bloodborne Pathogens, Part 3. Objectives. Understand the following. Types, proper use, location, removal, handling, decontamination, and disposal of personal protective equipment. Basis for selection of personal protective equipment. Hepatitis B vaccine. Appropriate actions to take and persons to contact in an emergency involving blood or OPIMs. Procedure to follow if an exposure incident occurs. Post-exposure evaluation and follow-up that the employer is required to provide. Signs and labels and/or color coding and elements of the bloodborne pathogen or BP standard. Proper PPE use and handling. For PPE to be effective, observe the following precautions. Remove protective equipment when contaminated and before leaving the work area. Place in an appropriately designated area or container. Remove garments when saturated with blood or OPIMs. Wear appropriate gloves when contact with blood or OPIMs is reasonably anticipated. Dispose of and replace gloves if torn, punctured, contaminated, or no longer function as a barrier. Never wash or decontaminate disposable gloves for reuse. Only decontaminate utility gloves if the integrity is not compromised. Wear face and eye protection whenever the risk of splashes, sprays, spatters, or droplets of blood or OPIMs is present. Wear protective body coverings when occupation exposure is anticipated. The selection of PPE is based on anticipated contamination with blood or OPIMs. Hepatitis B vaccine. This vaccine is free of charge to workers with occupational exposure. It's the best way to prevent hepatitis B, and it's given in 3 to 4 shots over a 6-month period. Possible side effects of the vaccine are you may still get the illness after exposure incident if the body does not respond to the vaccine, fever or soreness at the injection site, and in some cases, allergic reactions. If a covered employee declines the vaccine, he or she must sign a declination form which says he or she knows the risk and vaccine was made available but declined by the employee, may get a free vaccine later if still have occupational exposure. Emergency action. Your response to an injured or ill person depends on the assigned job role and consists of the actions identified by TRIASIM. If there's an emergency, you should take these actions. Use universal precautions and treat all blood and OPIM as if known to be infectious. Notify those who are trained and equipped to properly respond and follow safe work practices. Report an exposure incident. If an exposure incident occurs, notify your supervisor immediately. If someone else's blood or OPIM is splashed onto your clothing or shoes, remove these items and place them in a biohazard bag or receptacle. Minimize the exposure by immediately flooding the exposed area, most likely your hands, with water, then thoroughly wash the affected skin with soap and water. Flush any splashes to your nose and mouth with water. Irrigate your eyes with water or saline solution if there are exposure to blood or OPIM. Report the incident to your supervisor so that a record of the exposure can be documented. A medical evaluation can be made available to you if required, and TRIASIM can look for ways to prevent a similar incident from happening again. Be sure to seek medical attention as soon as possible after the incident. Post-exposure. If the exposure incident occurs, understand that medical evaluation and follow-up will be available at no cost. Evaluation and follow-up will be performed by or under the supervision of a licensed healthcare professional. Laboratory tests will be conducted by an accredited laboratory at no cost. Medical evaluation and follow-up involves the following: documenting exposure route and circumstances, identifying and documenting the source individual, testing the source individual's blood, making the results of testing available to exposed employee, collecting exposed employees' blood, providing post-exposure measures, providing counseling, and evaluating reported exposure incidents or illnesses. The healthcare professional will be provided a copy of the OSHA Regulation 1910.1030, which is the BBP standard, description of exposed employees' duties in relation to exposure incident, documentation of the exposure route and circumstances, results of source individuals' blood testing, and all relevant medical records appropriate for treatment. Exposed employees will receive a copy of the evaluating healthcare professional's written opinion within 15 days of completion of the evaluation. Signs, labels, and color coding. Warning labels will be affixed to items such as containers of regulated waste, containers of contaminated reusable sharps, refrigerators and freezers containing blood or OPIMs, containers used to store, transport, ship blood or OPIMs, contaminated equipment being shipped or serviced, bags or containers of contaminated laundry. Labels will be fluorescent orange or orange red with lettering and symbol in contrasting color. Be affixed as close as feasible to the container. Items that do not need labels. Labeled containers of blood released for clinical use and regulated waste that is decontaminated. The BPP standard contents. A copy of the 29 CFR 1910.1030 is available at the OSHA.gov website. The link is noted below. This standard contains 11 core things that we must do. 1. We must identify job classes, tasks, procedures with occupational exposure, train covered employees at the initial assignment and annually, establish, review, and update written exposure control plan and make it available, offer free hepatitis B vaccinations to covered employees, ensure employees use universal precautions, identify, use engineering and work practice controls, provide appropriate PPE, ensure proper disposal of contaminated sharps and other regulated waste, ensure biohazards are communicated with labels or color coding, offer post-exposure evaluation and follow-up at no cost, and preserve and maintain employee medical records and training.